Thousands of women across the country were forced to change their birthing plans once the coronavirus hit. But the changes in hospital pregnancy policies have only exacerbated an already alarming health crisis for African American mothers, mother and infant mortality. So freelance reporter Nina Bahadur is with me now to explain more of this. You did a great CBSNews.com piece on this, how COVID is making Black birth more complicated. So thank you so much for joining us. We have talked a lot about how this virus has exacerbated inequalities in many different areas that already existed in this country, but it's really glaring when it comes to health and health outcomes because Black folks are dying. So let's start with your article, and you profile Stephanie and how she was diagnosed with preeclampsia. After being dismissed by her doctors, they dismissed her pain. And we know now, because there have been studies done on this, that, her experience, she's not an outlier. It happens often enough that doctors dismiss the pain and minimize the pain that Black patients are expressing. Can you talk a little bit more about that?
Absolutely. First of all, good morning, Anne-Marie. Thank you so much for having me on. So Stephanie's story is not a standalone story. As you mentioned, this happens all the time. She was a first-time mother expecting twins. Because of the multiples in her pregnancy, she was considered high risk. And due to the pandemic restrictions, she had to attend a lot of appointments alone. What she realized is that her providers weren't really listening to her. She generally has a very low blood pressure, and she felt like her numbers were high for her, but because they were technically in the normal range, her providers kind of dismissed that, said, probably everything's fine, wouldn't worry about it. As it turned out, she had a very serious case of preeclampsia that was not caught for weeks. Luckily, a physician did notice, saw that her numbers were not at all right for her, sent her to the ER right away, where thankfully she was able to safely deliver. But this story could have gone so wrong if she had continued to see physicians who just weren't listening to her.
We know that there are many similarities between the underlying conditions that make people more susceptible to COVID-19 and underlying conditions that make pregnant women more at risk of dying in childbirth. Can you talk a little bit more about what this says about the overall health care that Black women are receiving?
Absolutely. The sad and horrible truth is that Black moms are 3 to 4 times more likely to die from pregnancy and childbirth-related problems than white ones. There are a ton of different factors at play here, and a lot of these factors are relevant with how we treat COVID as well. One issue, there's a shortage of physicians all across the US, and so many of our doctors in our hospitals in rural areas or low-income areas just don't have access to the resources they need to really treat their patients just because of funding issues. Another major issue is lack of health insurance. For example, some Medicaid plans will only kick in once a woman is already pregnant. So that means mothers are not getting care prior to conception. They come into pregnancy with these health conditions that put them at high risk for complications, things like diabetes, high blood pressure, other issues like that. Something that experts are also very much looking into is implicit bias. That's when some doctors, without even realizing it, make treatment decisions that's influenced by something like a patient's race, a patient's income, their marriage status, that leads to unequal care. So with COVID specifically, the concern is really that our hospitals and our healthcare providers are so overwhelmed fighting this virus. They are doing absolutely everything they can to stop COVID from spreading, but they're worried that their patients might be falling through the cracks who don't have COVID. And that's so especially scary for Black families in light of these numbers that we're talking about.
Yes, and when you think about the fact that because of COVID, many hospitals are allowing fewer people into the hospitals.
Right.
It's so important to have an advocate there for you when you are in pain, when you are distressed, when you are just, you're worried when you're pregnant. Every little thing you feel, you're not sure if it's, right or wrong, and sometimes you need somebody who's a little more clear-headed, who can call a nurse or call a doctor and say, no, this is what she's saying, and I think you need to take care of it. Can you talk about the impact of not being able to have an advocate there for you or having fewer advocates, and how, yeah, it impacts, every patient, but for Black women in particular, why it can be problematic?
Of course. So, as we just mentioned, there are these horrible health disparity numbers with our Black families. Black women know about this. They are already scared that something is going to happen to them, that they are not going to come out of the hospital alive, that they are not going to meet their baby. And so a lot of families who got pregnant prior to the pandemic, they have all these plans in place to have advocates with them during labor. So a woman might want their partner there, they might want their own mother there. A lot of people hire a doula, which is a birth worker who can
Hmm.
advocate for you in labor and delivery, or they might want to work with a midwife. And because hospitals are working so hard to keep all of us safe, many of them are limiting the number of people you can have with you. So you only get to pick one. That's a really tough decision for a lot of families, and especially for families who have other children at home. Who's caring for those children? Are they putting themselves at risk of COVID? So some mothers end up giving birth alone, just because it's the best choice for their families. But that is such a scary experience because they had planned to have advocates for them there to be with them in this really scary time, this time of pain, and they're not able to have that anymore.
Hmm. Yeah, and often you don't know what is normal and what is not normal, and you're really depending
Right.
on the staff. But if the staff is overwhelmed, they may not hear you. And when we talk about the fact that there are already biases sort of baked into the system, it can be really, really scary. And we know it's more than scary. We know the statistics. It can be downright
Yeah.
dangerous or fatal for the women and for the children. And if anyone digs into the statistics, you will find that in some areas of this country, when it comes to infant mortality and maternal mortality, the numbers are similar to some things that you find in some developing countries.
Right.
It's embarrassing, and then we add this whole other layer, right? So in the midst of all of this, because we are all trying to socially distance and doctors are doing the same, we have the emergence of
Yep.
all this telehealth stuff, which is great in many, many ways, because you have access to a doctor, you don't have to put yourself at risk, but it only works if you
Completely.
have a computer and Wi-Fi. So you have
Yeah.
another sort of barrier here for many African Americans.
Yes. So, in many ways, telehealth can be great for patients. As you said, you can do it at home. You don't have to take the time to travel to a provider. And of course, you're not worried about exposing yourself to COVID. But not everyone has access to that. And that's both on the patient side and on the provider side. And there are also some things that you just miss when your appointment is over a video screen. So some patients might have a blood pressure cuff at home where they can take their own numbers. They might be able to check their own blood sugar levels at home. Not everyone has access to that. And so doctors are so worried that even though they are doing everything they can, they're doing their best to keep their patients safe. There are things that you just miss over video when you're not seeing a patient in person. Sometimes physicians in person will just say, you don't look quite right. I want to run some more tests. And over video, you just don't get that interaction.
Yeah, great point. So we've been sort of raising the alarm through this whole conversation, but I want to give people some advice that they can actually use, that they can walk away feeling empowered. Do you know what I mean?
Of course.
So, what can you do? What can Black women do to advocate for themselves? Is there anything they can do to adjust their birthing plan to make sure they have the most positive experience and the best outcome?
Yeah, of course. Something that everyone can do is just educate themselves, learn about what some common complications are in pregnancy, know what the symptoms are to look out for. Another thing that you can always do is try and get a gynecological family history. That can be so helpful. So if you know that your mother had some complications during birth, if she had anything going on that could also happen to you, talk to her. What was that like for her? What was she able to do about it? Also know that, of course, our physicians and our healthcare workers want everyone to go home safely. They are doing the absolute best they can. And what you can do is really approach your healthcare as a team effort. So if you feel like someone is not listening to you, you can always ask for a second opinion, or you can just say, I'm really trying to approach this healthcare, my health. We're a team. This doesn't feel right for me. Could you please just test me again? Let me know what you would recommend. And just try to approach it as a group thing rather than they are the provider who knows everything and you're the patient who doesn't know anything, because you know your own body better than any doctor can. If something doesn't feel right for you, always ask for a second opinion.
Yeah, Nina, that is good advice across the board, not just for pregnant women, not just for African Americans. I mean, everyone. That is excellent, excellent advice. Nina, thank you so much.
Thank you so much for having me.